back. Today we're going to be talking about what to look for in an RMT, or a Registered Massage Therapist.
First thing would be, or at least in Canada, a registration with their own provincial college. We are in Ontario, therefore we are registered with the College of Massage Therapists of Ontario, or the CMTO.
Yeah.
There are currently 5 that are regulated in Canada. There's British Columbia, there is Ontario, New Brunswick, Prince Edward Island, and Newfoundland. The registration basically will allow you to have, for us to be able to write receipts that you can take to your insurance claims.
Yeah. Also kind of speaks to a bit of a higher level of education that we would have went through, other than, you know, someone that may be practicing in more of an aesthetics profession, which is not knocking them, but it just kind of,
This is different.
yeah. So speaking on what to look for, one of the biggest things is probably the personality and then their approach to massage. Personality is a huge one, because the key thing is you want to develop a good rapport and trust with your RMT. If you are someone that is, you know, very kind of sarcastic or happy-go-lucky and all this, you're going to want to find someone that's similar to you in an RMT. That being said, if you're very straight-laced and by the book, you may want to find someone that's like that as well. You just want to feel comfortable and that you're being heard and seen by your therapist. So that thing, we're going to talk about the style, and that's not just their clothing or kind of their personal style that way, but it's their style and approach to massage. So Kelly and I are both RMTs, but our approach is very, very different. Outcome is the same, but yeah, the approach is different. And that's nothing to be, you know, knocked or anything like that, but it's just different. So finding, you know, the best RMT for you may take some time. It's kind of like Goldilocks and the Three Bears, but it's you and finding the best massage therapist for you.
Some of us will be more pointy and be working things out. Some of us use a lot of pressure. It's more kinetic and moving things at the same time. There's every technique is different with their approach.
Yeah, absolutely. So that being said, it also kind of speaks on to RMTs that maybe go and specialize in certain aspects of our careers. So there could be some that go into manual lymph drainage. There could be some that do a cupping course like Kelly has done. We've both done the Indian head massage. And then just kind of goes on from there. So I've done my doula, which I can incorporate into massage, but yeah, so it's just kind of,
we all have but we have a college diploma, and then anything above that is different for everybody.
Yeah. And then in turn, if you're looking for something more specific, finding out if your RMT specializes in that, that's just a big bonus, right? Also, that being said, is do not be afraid to ask questions.
Yes.
You need to ask. If what your RMT is discussing about your treatment plan, you need to understand that. You need to understand what's going on, because you're going to be on the table underneath these sheets, you know, like
in your underwear.
Yeah, so you're going to be in a vulnerable state. And so we want to make sure that that client and therapist relationship is on the same page. At any point that may change, and then you just let your therapist know. So maybe we're working on an area that's really sensitive that you didn't realize, or it's painful. So bringing those, you know, concerns up with your therapist makes a huge difference in our treatment for you and how you're going to feel after treatment.
That being said too, her deep pressure and my deep pressure are not the same thing. Your deep pressure is probably not the same thing. We all have our own in our head. It's very subjective.
Yeah.
Therefore, the same thing, you might be more sensitive in your legs as opposed to your back, or vice versa. It really doesn't matter. Even within your back, there might be like a spot that you're like, oh my God, and you're flying off the table and levitating. That, you know, we can decrease the pressure at that point. It doesn't need to be all uniform and symmetrical.
Absolutely. And your RMT should be asking you questions as well. So whether you're on the table, if you're comfortable, if anything can be arranged so that you're more comfortable, if, you know, the pressure is okay, if say your leg is undraped, you know, that's comfortable, okay, we're good to go. just the thumbs up to progress into your treatment plan.
Mm-hmm.
So really, into that's kind of like
what we're talking about with the pressure and all that. It's when you come in, especially if you have your own notions about what pressure means to you, also coming in and having an idea of what you're coming in for.
Yeah.
If there's something going on with your shoulder, for example, or your neck or whatever, the more adjectives that you can use to describe what you're feeling was very helpful for us.
Yeah.
If there's something shooting, aching, burning, spasming, cramping, anything like that, any adjective is very helpful, and especially where you feel it. If it's in your neck and you feel it down into your hands, for example, that is very helpful.
Yeah.
Just knowing what your own plan of action is and what you were thinking before you came in the door today.
Yeah, absolutely. It's just checking in and making sure that everybody is on the same page. That's probably the most important thing.
The most important, yes.
Yeah. So really, in conclusion, like we just said, yeah, like everyone should be on the same page. You want to be able to make sure that you are consenting to what your therapist is going to be performing. And like I just touched on before, if anything is uncomfortable or you change your mind at any time, that is okay, and you just have to let your therapist know. Thank you for taking the time to visit. If you like our video, hit that like button below, and if you want more content, hit that subscribe button below. We really appreciate it.
We'll see
We'll
you
see you soon.